The following video will provide an introduction to sensory processing, answer common questions about the type of sensory processing problems children can have, and begin to explain how sensory challenges can influence a child's behavior. This video has been made for people whose children have been referred to occupational therapy for sensory processing assessment. It may also be useful for child care workers, educators, extended family members, and others who care about children with sensory processing challenges. The information provided is general and not designed for a specific child. It is not meant to be medical advice or to replace medical care. It does not substitute for OT assessment or treatment. But we hope it will help you better understand how sensory processing challenges may affect important children in your life.
Hi, my name is Stephanie Weens. I'm a pediatric occupational therapist, or OT. Thanks for joining me for this introduction to sensory processing. In this introduction, I'm going to explain and define some common sensory terms, provide information about the kinds of sensory processing problems and challenges children can have, and answer some frequently asked questions about sensory processing challenges. Let's get started. Just what is sensory processing?
The world is full of sensory information. Everyone, children and adults, takes in information from the senses all the time. These sensations travel through nerves to our brain, which organizes the information into the right categories, figures out what it means, and plans a behavioral response. This is called sensory processing or sensory integration. We are constantly receiving information from all 7 of our senses, so our brains are constantly involved in the tricky but invisible and usually subconscious art of sensory processing.
At the very end of that sequence, I mentioned the 7 senses. Many of us are only familiar with 5 senses, so let's take a moment right now to look at what the 7 senses are.
There are 7 senses. Yes, 7. There are the 5 senses that many of us remember from school. The sense of sight. The eyes are the sense organ for sight, which is also called vision or the visual sense. The sense of hearing. The ears are the sense organ for hearing, which is also called the auditory sense. The sense of taste, which is also called the gustatory sense. The tongue is the sense organ for the 4 basic tastes: salty, sweet, bitter, and sour. The rest of what we generally call taste actually comes from the sense of smell, also called the olfactory sense. Our nose is the sense organ for smell. The 5th sense is touch. Our skin and mucous membranes are the main sense organ for touch, also called the tactile sense. Our skin has receptors for several different kinds of touch sensations, including light touch, deep pressure, temperature, pain, and vibration. There are 2 other important senses which most of us didn't learn about in school: the vestibular and proprioceptive senses. These give us information about the movement and position of the head and body. In fact, sometimes these 2 senses, plus parts of the sense of touch, are lumped together and called the kinesthetic or movement sense or senses. Let's look at the vestibular and proprioceptive senses separately. The vestibular sense tells us the position of our head and how it is moving in space. The vestibular system, tiny little bones and ligaments in your inner ear, is the main organ for this sense. The vestibular system tells your brain what the position of your head is in relation to gravity and senses how your head is moving in space. The vestibular system senses circular, up and down, forward, backwards, and sideways movement. It also tells you whether you are speeding up, slowing down, or changing directions. This sense is very important for knowing in what direction and how fast your body is moving, coordinating movements of your head and eyes, and keeping your balance. The sense that tells us the position of our joints and muscles is called proprioception. There are sensory receptors called proprioceptors in all of our joints and muscles. These receptors send information to the brain about when and how our joints and muscles are bending, straightening, or being stretched or pushed together. Proprioception is the sense that lets us know where the arms, legs, or fingers are without us having to look, lets us copy an action without having to watch ourselves do it, and because it tells your brain how far your joints are being stretched or compressed, that is, pushed together, it also lets you know how hard or softly you have landed when you jump, tells you whether you can stretch your arms any further when you're trying to grab something, and tells you how much force to use to pick something up without squishing it.
So, we've reviewed the 7 senses. Now, let's really get into sensory processing. Sensory processing, also called sensory integration, refers to the way that our brains receive, interpret, and process information from all of the senses. You can think of it as happening in 3 steps. Step 1, sensory information is taken in from the senses. Step 2, the sensory information is processed in the brain. That is, it's interpreted, organized into categories, and assigned meaning in the brain. And Step 3, an action is carried out in response to the information that was taken in and processed. These 3 steps happen so quickly that most of the time it's not possible to see them happening or break down the steps. One time that you can almost see them happening is when you're watching a new baby who's just learning how to reach and grab for toys. Let's do that right now.
This baby's about 3 months old. She's just starting to successfully reach for and grab things. Something has caught her eye. What is it? It's a toy. See how her whole body starts to move almost as soon as she sees the toy? Sometimes her legs relax and she reaches just with her arms, but her legs get moving again when she's trying really hard or when she gets really excited. This overflow movement happens in babies as they learn to move their bodies on purpose, also called developing voluntary motor control. Once she's grabbed the toy, she immediately completes a second purposeful action. She brings the toy to her mouth. She's been putting things in her mouth for a few weeks now, so she does it pretty quickly and efficiently. That's one delicious frog.
As babies learn to move their bodies on purpose, they move through the 3 steps much more slowly than older children and adults do, so it's easier to see them happening. Let's watch the video again, and this time we'll put the steps up on the screen as it plays.
Step 1. Sensory information is taken in from the senses. In this case, the baby sees something that she's interested in. 2. The sensory information is processed in the brain. That is, it is interpreted, organized, and assigned meaning. You can almost see the gears turning in her little brain as she sees that toy she really wants. 3. An action is carried out in response to the information that was taken in and processed. She reaches for the toy and brings it to her mouth. Success!
For older children and adults, the 3 steps happen so quickly and with so many different senses at the same time that it's impossible to keep track. In the next sequence, Sensory Processing in Everyday Life, we'll look at one example of all the sensory information that needs to be taken in, processed, and acted on during one seemingly simple everyday activity, eating lunch.
Sensory processing is hard to explain because it's invisible and, when it's working well, we don't even think about it or know that it's happening. Even doing something as ordinary as eating lunch outside, children constantly encounter and need to process and react to sensations from all 7 senses. They see not only their food, but everything around them and what their family is doing. They hear the sounds of themselves and others eating, talking, and all the other sounds in the backyard. They taste all the different kinds of food they are eating and the milk they are drinking. They smell the food they are eating and that others are eating, as well as other smells in the backyard. Newly mown grass, subtle smoke from a barbecue half a block away. They feel the touch of the food in their hands and in their mouths. They feel the bench under their bums, their clothes resting on their bodies, and the breeze against their faces. Their vestibular sense helps them keep their balance as they sit on the bench and lets them know if they're leaning too far one way or another. Their proprioception or joint position sense lets them know how heavy their cups are as they pick them up and helps them to reach and move accurately. As these children eat and move around, they are constantly going through all 3 steps of sensory processing. Every action that they take leads to new sensory experiences which need to be processed, which leads to the next action. It's a constantly revolving cycle or feedback loop. If there is a problem with any of the 3 steps, if the senses are not able to take the information in as expected, or if the senses take the information in but then the brain does not process it, or if the message to carry out an action based on the sensations taken in and processed does not get through, the cycle of sensory processing will necessarily be broken up and children will not behave in ways we find typical. In that way, you could say that the symptoms of sensory processing problems are the way that a child acts or behaves.
If there's a problem with any of these 3 steps or a disruption in the cycle of sensory processing for any reason, problems will occur. Let's talk about the problems that can happen at each of the steps. Some children have problems with step 1, the way they notice or take in sensory information, also known as sensory registration. In order for us to register or notice a sensation, it has to cross what's called our sensory threshold, or the point at which we notice sensory information. If you have a very high threshold for a certain sensation, it means it will take a lot of that sensation for you to notice it. If you have a very low threshold, it'll take very little of that sensation for you to notice it. As you can imagine, having either a very high threshold or a very low threshold can cause children problems. So let's talk about the 2 different kinds of problems separately. Children with a very low threshold for a certain kind of sensory information will over-notice those sensations. This is also called being hypersensitive. These children may have extreme reactions to sensations that others would perceive as normal. Let's look at an example using touch information. Children who are very sensitive to touch or tactile information may have a real problem wearing a shirt that's got a tag in the back of the neck. Have you ever met a kid like that? You put a shirt like this on them and it seems like they can't pay attention to anything else. It's as if you've put a hot poker in the back of their neck. And until you cut that tag out or give them a different shirt to wear, they just can't get on with their day or focus on anything else. Children who over-notice sensations may avoid activities and situations that children usually like. Or they may have extreme reactions, such as being afraid or angry, to sensations that just don't seem that extreme, like the tag of a shirt. Other children will have a high threshold for a certain type or types of sensory information and will under-notice and under-react to that type of sensory information. This can also be called being hyposensitive. Children in this category may seem to ignore sensations that are very clear to you or need a lot of sensation before they react. They may seek out extreme sensory input, which causes them to act in ways that can seem unusual or annoying or even dangerous. One example would be the child who loves to spin. They spin and spin and spin so fast and for so long that watching them you're sure they're going to get sick, but they're not even dizzy when they're done. That's an example of a child who has a very high threshold for vestibular input. A few important notes about step 1, sensory registration. The same child may both overreact to and underreact to different sensations or even the same sensation depending on what they're doing at the time, how they're feeling, and things that are going on in the environment. In fact, it's not only children with sensory processing challenges who may react differently to the same sensation. For all of us, our sensory thresholds can go up and down depending on a number of factors. Let's take an auditory or hearing example. Imagine that you're really engrossed reading a book. You just are paying attention to this book and suddenly someone says, "Why aren't you listening to me?" They've apparently been calling your name, but you didn't even hear them. This would be an example of your sensory threshold for sound being very high because your attention was somewhere else. There are other situations in which we're hypersensitive to sound information. Imagine you wake up in the middle of the night. You're alone and it's dark. Suddenly, your threshold for sound is lowered, and you hear the creaking of the house as it settles, maybe banging in your pipes, all kinds of things you don't usually notice. Have you ever been in that situation? If you have, you can imagine what it's like for children who regularly over-notice a certain type of sensation. Let's move on to the next step. Sometimes children will have problems with step 2, processing the sensory information in the brain. When this happens, sensations are registered or noticed correctly, but then are misinterpreted somehow in the brain. Step 2 problems are the hardest for us to see, and so they tend to be the hardest to understand for those of us who process sensory information in a typical way. OTs will often use a computer analogy when talking about sensory processing problems. If you think of the input as the sensory information that's taken in and the output as the action that's carried out, What goes on inside the computer is the equivalent to step 2, the processing of the sensory information. So let's say I type in cat and then the computer spits out strawberry. That doesn't make any sense to me because I don't know what's gone on inside that computer. For a child with sensory processing problems, we don't know how the brain misinterpreted the information. We just know that the output, the child's behavior, is not what we expect it to be based on the input or the sensory information that we saw the child take in. The final step of sensory processing is carrying out an action based on the information that was taken in by the senses and processed in the brain. There can be a problem with this step for a couple of reasons. Some children will take in and process sensory information correctly, but then experience a problem getting the message of what action to carry out to the muscles. The message may be slow getting there, so the action is delayed, or it may get blocked completely, so there's no action at all, or it might get garbled in transmission so that the action that's carried out is not quite right for the situation or not quite what the child intended. Of course, there will also be a problem with step 3, carrying out the action, if there was a problem with step 1, registering the sensory information, or step 2, processing it in the brain. A child with problems with step 3, sometimes called a sensory processing motor problem, might use more strength or force to do a task than the task needs, or less, or just in the wrong way. Because of this, the child's actions may seem clumsy or uncoordinated or disorganized. Next, I'd like to address a few frequently asked questions. The first is, how can you tell if a child has sensory processing challenges or problems? Many children with sensory processing challenges may be described as one or more of the following: clumsy, uncoordinated, irritable, unsafe, withdrawn, highly distracted, and destructive or rough on people and objects. Families or teachers may note that these children are constantly moving or won't sit still, have trouble following directions, have difficulty moving from one activity to another, demonstrate a desire for predictability or control, and become very anxious or have extremely negative responses such as tears, tantrums, or refusal to participate to activities that rarely bother other children. Of course, every child is unique and may show that they have sensory processing problems in different ways. Another commonly asked question is, why do children have sensory processing differences or challenges? There are many reasons why children might have sensory challenges and many different degrees of sensory challenge that children might face. Most children who face sensory challenges do not have any kind of diagnosis. There's no known reason for their sensory challenges. It's just part of what makes them who they are. Sometimes children are diagnosed with sensory processing disorder, or SPD, also known as sensory integrative dysfunction, or SID. This diagnosis would be made by a developmental pediatrician or other doctor. Currently, this diagnosis is used in the United States much more often than it is in Canada. This diagnosis isn't necessary, it's simply a label that is used to describe the child and which can be helpful to parents and professionals in understanding and explaining why the child behaves the way he or she does. It is not necessary for assessment or intervention. Other children have sensory challenges because of another condition or diagnosis. For example, some genetic disorders, including Fragile X and Down syndrome, fetal alcohol spectrum disorders, and autism spectrum disorders are all often associated with various degrees of sensory processing differences. This does not mean that every child referred for sensory processing assessment has an underlying diagnosis or additional challenges. In fact, the majority of children referred for sensory processing assessment do not have any kind of underlying diagnosis. Not everyone who fits some of the descriptions I used before has a sensory processing problem. When you're already worried about your child, it's easy to become even more worried from general information that you might read or come across on the internet or see in a video. It's important not to jump to conclusions about your or any child based on general information. I'd just like to put in a quick word about information you may come across on the internet. Experts recommend that you evaluate every website that you might use for personal information or research. I wasn't sure personally how to do that. One acronym I came across that was really useful was CARS. It stands for Credibility, Accuracy, Reasonableness, and Support. If you enter Evaluating Internet Resources or CARS checklist into a search engine, you'll come up with useful information that can help you evaluate the internet resources you might find. The last but not least commonly asked question is, what can I do if I have concerns about my child's sensory processing? First, if you haven't already, discuss your concerns with your doctor or other healthcare practitioner. It's important that your child be investigated for medical or health problems. They should have a thorough medical exam and have their vision and hearing tested. Ask for a referral to occupational therapy. Occupational therapists are experts at assessing children's sensory processing. In Canada, public OT services vary from province to province. In Manitoba, preschool children are eligible for publicly funded OT through the Children's Therapy Initiative. You may in fact be watching this video because you're already waiting for or receiving these services.
There are also private therapy options. www.msot.mb.ca provides a list of private providers in Manitoba.
Finally, try looking at your child's and your own behavior from a sensory point of view. By becoming attuned to the sensory environment and the sensory events that may trigger your child's discomfort, difficult behaviors, or withdrawal, you can begin to address root causes instead of having to react after the fact. You will also be gathering valuable information that your occupational therapist can use to help you and your child. That brings us to the end of this introduction to sensory processing. Remember to check out the DVD menu for additional helpful segments, and of course you can re-watch this or the other version of the introduction anytime.